So let's start with Ria. How can you prioritise sustainability initiatives in DHBs when the clinical staff are experiencing burnout and don't have time to engage?
Oh, that's a really excellent question. I think that it's really key to begin with addressing that burnout and looking at some of the things that drive it. So, because I think it's fundamental that for a health workforce to be able to work sustainably, self-care and self-compassion is fundamental, it's integral. I sometimes am concerned with some drives for sustainability that just so focus on resource management and forget the well-being of the staff working there. So I agree, I think that's where it needs to start, is with looking at staff well-being and how that can be supported through education initiatives. And that's a first step before moving out into looking at other aspects of sustainability.
Thanks. Do we have Luke online?
Yes.
Great. What about indoor temperatures? Lakes District Hospital had a significant problem with high temperatures indoors during a heat wave.
So I guess what I would say is that each of those dots on those maps that I was presenting, they represent a proxy for impacts for that wider area. So you don't necessarily rely on that specific temperature out of the airport to tell you what's going to be happening in your house. We know that there's all these different sort of microclimates within a city, and that same thing goes with indoor temperatures. I think that probably one thing to say about indoor temperatures is that it's probably one of the easiest things to where there are adaptation solutions that are quite obvious right now. I think the same thing has been happening in the UK, where perhaps your buildings are designed such that you haven't necessarily prepared for exposure to these sorts of high temperatures. So perhaps that might be the case in the Lakes District when they had really cold temperatures in the past in the wintertime. So I'm totally not surprised that may well be the case, but I think what you'd have to do is to be able to say something about indoor temperatures when temperatures at a specific station for Queenstown is showing X. You'd have to do a bit more detail and a bit more digging to figure out what that relationship actually is.
Great, thanks. Mikey, how do we support parents to understand the mana of our youth and that civil disobedience is a right?
Easy. Thank you for the easy question. I feel like a lot of my clinical work is about helping parents understand the mana that their young people already have and helping them kind of shift between the way that they relate to their children from being kids to being young adults. And I think that's part of it. It is about kind of like, it is about helping parents have that shift in how they're viewing the young person. In terms of like encouraging direct action and helping them understand that, I might ask my mum that, who paid for my first lawyers. It's not that simple, I don't think, especially because we already have a lot of resistance within climate change movements to the right and importance of direct action. And so we probably have to expand that discussion when we're including it with parents. Yeah. Yeah.
Okay, and on to Matt. Carbon costs from procurement is going to be high for New Zealand due to geographical location. Should government encourage self-production of associated equipment?
Yes, it definitely will be high due to our geographical location and the economic input-output life cycle assessment doesn't really account for that very well. Even if we did make them here in New Zealand, we still have to import a lot of resources and materials to get them here, like plastic, various metals and such. I think it's more the moving from single-use devices to multi-use or instruments that can be sterilised would be the main thing. Whether they're made in New Zealand or made overseas, I don't really have any strong opinions on. But just moving from single-use to multi-use is the main thing.
Back to Ray. Oh, no. Yeah? Okay, back to Ray. How would you integrate sustainability education in DHBs?
Oh, that is the question that I already addressed.
Is it?
Yeah, thank you.
Okay, sorry.
Not? How would I, okay, so how would you integrate, oh, okay, sorry, I just read it, you're right, I didn't. Okay, I think, it's how would you integrate sustainability education in DHBs? Well, it would be great for DHB educators to do that. Again, I think that the key issues that need to be addressed would be to look at the effects of climate change on health. Like, so much of the information that's been shared here is not nearly as widely known as it should be within the health sector. And I think, again, like looking at positive initiatives that people can do is really important, because I think that feeling engaged and feeling like you can make a difference, is really crucially important, to not be overwhelmed by the enormity of what we face.
And now a question for the other Matt. How do you think that framework becoming mandatory in New Zealand is going to affect business practice?
Thanks. Yeah, the TCFD framework becoming mandatory in New Zealand, I think, is going to be very important. I mean, the point of that TCFD framework was originally designed to inform investors so that they could move their money out of companies that are not dealing with their climate-related financial risks well and into ones that are. So it's going to start to make more apparent that if you're a company like, say a large airline that may currently have a great reputation for sustainability, when it becomes more well known that that company is also one of the largest emitters in New Zealand, they might start to have to figure out exactly what they're going to be doing about that and starting to answer it. So the idea is that by having more information, there will start to be a flow-on effect, and that will drive action. And one of the ways that you can drive action is by putting the money where it should be and taking it out of where it's not going to be profitable. So hopefully that investor-led change will start to make more of a difference. That will have a ripple effect also to the public sector too.
Okay, Danielle, how can we ensure indigenous values and approaches are used to help adaptation within the health system?
Yeah, great question. So I would say that mana whenua have to be at the table. It's not down to people like me to tell policymakers what to do. I can shine a light on what's happening in communities, but at the end of the day, if policy is going to become more responsive to what is going on within Māori communities, within Māori whānau, they have to be the people that speak and engage with people who are leading change in the health systems. I would say that they would also need to be resourced to do that, and that's something that I encounter a lot during my research, is that mana whenua, ahika, people on the ground at home do a lot of work for free to try and improve the well-being of current and future generations. And when it comes to engaging with actors like council, like government, at any level, they would want to be resourced for that. So I would say that it's important just to go out and get the people that are going to be involved. Thank you.
Okay, question for Olivia. Can you give examples of how the healthcare system or DHBs can integrate climate migration support?
Yeah, sure. I'm quite stoked this question has been asked, actually, because the first thing that springs to mind is to celebrate and acknowledge Kiribati Language Week. It's in 2 weeks' time, and I can almost guarantee that within each of your DHBs there will be a Kiribati community, and probably many of them might not be accessing the healthcare system, but there may also be Kiribati staff who work within the DHBs where you are. So, yeah, go onto the Ministry for Pacific Peoples website and find out about Kiribati Language Week, find out if there are Kiribati staff, create a space where they can share and showcase their culture. One of my participants talked about the joy that she felt doing that in her workplace, and she was a nurse. So that's one example. Another thing that springs to mind, and Danielle touched on this as well, is Pacific representation and leadership. Like, this is so important for a climate migration response, which centres cultural values. And building upon that kind of cultural competency for staff as well. Understand the language of the people that you're dealing with and greet them in that language. One of my participants said to me, when you see us and you say Maori, which is hello in Kiribati, you're saying, I see that this is a Kiribati person and I value them. So that's pretty significant. And the final thing that is important to touch on is that when we're talking about climate migration, currently there are a lot of people from low-lying atoll islands like Tuvalu, Kiribati, Tokelau, who are living in New Zealand without formal recognition and so can't access healthcare. So it would be good for people to be able to canvass who are the irregular migrants that are living within the area and how are there ways that we can support them, whether it's in terms of accessing perhaps support with diabetes or with cardiovascular disease, even just lowering the costs that it might take to access that healthcare or go and visit people in their houses, that kind of thing. That's quite critical. And then, of course, on top of that, there are so many ideas, but fundamentally, mitigation is critical. We want to treat the problem before it happens, right? So doing everything that each DHV can to reduce its carbon emissions. Yeah.
Great.
Next week, Kiribati, no, not next week, 12th of July, Kiribati Language Week.
Okay, a question for Sarah. Were any of the interviews with Maori community leaders, Kaumatua, iwi leaders, marae staff, etc.?
Yeah, so unfortunately not. Even before I formally actually began my PhD, I did reach out to build some of those relationships. So reaching out to Aotearoa, the local runaka and mana whenua of the area, and continued reaching out throughout my data collection process. And talked to a number of people, and unfortunately it just came down to capacity issues. There was definitely interest in the research, but for mana whenua, their pressing concern in particular is rising sea levels are already impacting and threatening their marae out on the Otago Peninsula. And so, yeah, their focus was there. Also reached out to a couple of Māori health providers in the area. And with COVID, I mean, they just had zero capacity. So yeah, it is a limitation of the research, and the results just have to be considered in that context.
Okay, we're almost at time, but I just wanted to quickly ask Mikey one final question. I often hear older people being grateful for the younger activists as they will come along, be inspiring and sort everything out for us. Do you have any comment on this attitude?
Yeah, and I think it fits with the other question that's on the board as well. And like, I think the problem is thinking that one single approach is going to solve things. And actually, we need people at all stages of our development as adults and older adults, and young people who have an enthusiasm and who have developing identities, which they're able to kind of like hone both of those things into a form of activism, which is, health professionals and adults we don't often have the time or energy for. Because in order to achieve meaningful change in this area, we don't just need policymakers, we don't just need innovators, we also need people activating on the street, creating the political will to actually enact all the changes that everyone here has been talking about. Without people on the street protesting, without young people putting their energy and their identity development into activism, all the work that we're doing has no value because there'll be no political will to act on it. So I don't think we can expect younger adults to activists to sort it out. What we can rely on them for is to add the extra political pressure to create the political will so that our innovations and our policies and our research can be implemented.